So 80% of Americans in their lifetime will suffer from low back pain. Low back pain is the #1 cause of why people miss work. It costs the nation over $200 billion a year. It's obviously an issue. Biggest causes we see that cause low back pain are the repetitive stresses, lifting injuries, and specifically lots of sitting. And that's what we see a lot of in our office, people who sit a lot. Now, unfortunately, in our healthcare system, we have the allopathic healthcare system, drug surgery, and you have the homeopathic healthcare system, which is more conservative care, chiropractors, acupuncturists. And unfortunately in America, these two types of healthcare butt heads a lot. And you'll get the best of one and or the best of the other, and they rarely combine. Now there's a time and a place for everything. However, I'm sure you agree with me, we should try all conservative care and exhaust all conservative care options before we go down the route of drugs and surgery. And again, there's a time and a place for that if needed. However, until we get there, we've got to exhaust the conservative care options. And in advanced health, I feel we're unique specifically because we incorporate all types of healthcare with under one roof. I like to call it the 360 degrees of wellness. First and foremost, we're chiropractors. And as chiropractors, we specialize in the treatment of your spine and specifically making sure the spine's in alignment. We also address joint function. Is the joint moving and is it stable through range of motion? And we address the soft tissue, specifically is it activating and stabilizing the spine. And that's where I feel we're unique, because we don't just focus on adjustments. We also incorporate lots of physical therapy in our office, specifically in 3 forms. First of all, we have to address the range of motion. A joint needs to move in its full range of motion in order to put appropriate load into the joint and the spine. Second of all, it needs to be stable through range of motion. And lastly, it needs to be strong. So if you sit all day, we've probably got that corporate posture, right? Where we just sit in this position. By sitting in this position, it can add up to 275 pounds of pressure on your spine. Obviously, over time, our body can't deal with this and we break down. So in advanced health, what makes us unique is we will address your spine through state-of-the-art imaging and see where your curvatures are and work on getting them back to within normal alignment. We'll adjust the joint and its function, make sure we restore full range of motion in the joint. And what separates us, we do lots of physical therapy. You'll be doing myofascial work to break up all the scar tissue that's formed in the tissue. You'll be doing lots of stretching and range of motion work, both static and active dynamic work. And you'll be doing lots of therapeutic exercises. You have to address your pelvic floor, these muscles that sit between your pelvis that activate and stabilize your low back. We have to address your posterior chain, all the muscles that sit in the back of our body, specifically hamstring and glute activation. Because if we're redundant here, our low back works too hard and it can cause low back pain. So if you're sitting at home and you've been to see a chiropractor and you felt relief through the adjustments, but the pain returned, and or you've seen a physical therapist and you saw relief through the stretching and the rehab, but the pain returned, it's probably because we didn't address the root cause of the issue. And the root cause is spinal alignment, joint function, and good tissue health in terms of how well it moves and how stable it is. So if you're sitting at home, you have a family member, a co-worker, a friend that's suffering from low back pain or has a recurrence of the low back pain and is looking for somewhere to correct this both short and long term, it's exactly what we do at Advanced Health. Tag, share the video, and we'll see you on the next one.